Great. We're all having a great time, and that's good, but if you could be seated, please, and we'll start. Thank you everyone. Good morning again everyone. I'm Christine Fitzherbert, I'm the Chair of Women's Health Victoria, and I'm absolutely delighted to see you all here and to extend a very warm welcome to all of you in the first of our series of 4 sexual and reproductive health forums. This is a very significant day for us and a very significant day for our forums. Most importantly and firstly, on behalf of Women's Health Victoria and all of us, I would like to acknowledge the traditional owners and custodians of the land and waters on which we meet today, the peoples of the Kulin Nation, and we pay our respects to them, to their culture, and to elders past, present and emerging. I'd particularly now like to welcome our very special guest today, the Honourable Gina Mikakos, Minister for Health and Minister for Ambulance Services. Gina Rushton from Buzzfeed, Beth Wilson, who will be MCing today and doing a great job of keeping us all in order. Sonia Ilievska, who is co-chair of Women with Disabilities. Sonia. Claire Visenga, Chief Executive Officer of Family Planning Victoria. Louise Johnson, Chief Executive Officer of VATA. Yamal Hakim, Acting CEO of Marie Stopes Australia. And Diane Hill, our Acting CEO of Women's Health Victoria, as well as other Women's Health Victoria board members, Kate Brown and Jennifer O'Donnell-Parisi. So it's very good to have everyone on board, and it's wonderful that there are so many people who have come today, and I think those especially who've come from the country and travelled to this very interesting venue. Has anyone been here before? No. It's a fantastic venue and one that we should learn more about. We're very fortunate that Minister Mikakos is able to attend to give us an update on the government sexual and reproductive health strategy. Gina Rushton is going to share with us some of the insights garnered from her considerable writings about women's experiences with contraception and abortion over the years. And you'll also have an opportunity to hear about the achievements of 1800 My Options, a service that we provide, and it's now in its first year. In 2019, Women's Health Victoria is also celebrating its 25th anniversary. It's a very special year for us, and we are very proud to have played a leading role in statewide advocacy for sexual and reproductive health throughout its history. We've seen a lot of wins over recent years, from abortion law reform in 2008 to safe access zones in 2015. To the very first ever statewide strategy for sexual and reproductive health in 2017. We're very pleased that we are running 1800 My Options, Victoria's first phone line and information service for sexual and reproductive health. We also undertake research and deliver training and resources and share evidence to influence policy making as we work towards our vision of women living well, empowered and equal. Women's Health Victoria is committed to improving the social, emotional and physical health and well-being of women throughout their lives, and expand women's sexual and reproductive health options and empower them to make choices that best meet their needs. I'm now going to hand over to your MC for the day, the redoubtable Beth Wilson, someone who is known to many of you, if not all of us, for her tireless work in our community over many decades. Beth Wilson is a former Victorian Health Services Commissioner. Over to you, Beth.
Thank you, Christine, for your warm introduction. My name's Beth Wilson, and like you, I'm really pleased and excited about this forum today. I'd also like to acknowledge and pay my respects to the traditional custodians of the land we're meeting on today, the people of the Kulin Nation. As a statewide organisation, Women's Health Victoria also acknowledges the traditional custodians of the lands and waters across Victoria. We pay our respects to them, their cultures, and their elders, past, present, and emerging. And it's great to see amongst the audience today so many different types of experts in women's health and sexual and reproductive health, all gathered here together in this terrific space, so that we can take stock of some of our achievements and set shared priorities for the work that we've got coming ahead of us. So amongst the audience today, we've got CEOs, doctors, gynecologists, abortion providers, counsellors, advocates, educators, policy makers, and many more. And it's a fabulous thing to see. When I started off in the law back in about 1980, I didn't even know one other single woman lawyer. To see you all in such important positions is every woman's dream realised, I think. So good on you. I've just reviewed a book called Winning for Women, written by Iola Matthews. And it's a fantastic book on the incredible fight for equal pay. We're not there yet, but we've come a long way. Gender gap, all that kind of thing. So look out for that book. It's a really important book too that shows you how incredibly hard people in the unions work to get up an award case before the Industrial Commission, and some of the crap they had to put up with from some pretty nasty male commissioners along the way. So today, why are we having this important forum? As many of you already know, Victoria's first ever statewide strategy, Women's Sexual and Reproductive Health Key Priorities 2017 to 2020, was launched on International Women's Day in 2017. The strategy provides recognition of the important role of sexual and reproductive health that it plays as a determinant of women's health and our well-being. The strategy, which the Minister will discuss in greater detail, represents a remarkable step forward and includes a strong commitment to increasing the availability of medical and surgical abortion, particularly for women in regional and rural Victoria, and improved access to advice and information, go High Court, and recognises the important role of hospitals in providing access to termination of pregnancy services. As a result of the strategy, sexual and reproductive health hubs are being established across the state. The strategy also funded Victoria's first ever statewide sexual and reproductive health phone line, 1800 My Options. That was, it's just had its first anniversary, and the achievements have been fantastic, and they'll tell you about that in a moment. But that success has been in no small part due to the support and engagement of so many people who are in the room today. The strategy has enabled and funded some really important work since 2017, but the strategy and the associated funding comes to an end in 2020. We're also at the beginning of a new term of government in Victoria. So it was for these reasons that Women's Health Victoria decided it was timely to present a series of cross-sector forums on sexual and reproductive health. And these forums will be designed to foster networks, share research, learn from service providers and consumer experience, and ultimately strengthen the service system in Victoria. The first of this series, that's this forum, is focused on bringing us all together to take stock of work achieved so far under Victoria's first statewide sexual reproductive health strategy, consider ongoing barriers to access in Victoria, and prioritise for future work. The forum today will be structured in two halves. We will be hearing presentations from the Minister, as you just heard, keynote presentation from Gina Rushton of Buzzfeed. Insights from the first year of 1800 My Options will be presented by Carolyn Mogharbel. Then we'll have a Q&A, and I'll take that as a comment. Then we'll be breaking for morning tea. After morning tea, there'll be an interactive workshop in which we'll work together to discuss and identify key priorities for improving sexual reproductive health across the state. That's when you get to do the work and share your ideas with us. Findings from the workshop will be used to inform statewide advocacy and assist with planning in the next sexual and reproductive health strategy, and inform the development of topics for future forums in the series. There will be a summary report made available via the Women's Health Victoria website, and you can all use that in your own work, planning and advocacy. Okay, a few logistics. As you know, this forum is facilitated by the Women's Health Victoria team. Thank you all very much for the work that you've done. It's a free event, but it's sold out really quickly, which is a great indication of how keen people are to discuss these issues. And because we had so much interest and couldn't have seats for everyone, we are making an audio recording of presentations and the Q&A discussion. So these views can be shared with people who can't join us today but will have access via the Women's Health Victoria website. During morning tea, we'll turn off the recorder so you can freely network and say whatever you like. Those who asked to be put on the forum wait list and those who weren't able to attend for other reasons, including travel time, have been invited to have input via a survey online. Their suggestions will also be incorporated into the workshop notes and final report. At 1 o'clock we'll be doing a quick so just before we wrap up, at 1 o'clock, that'll be the close of the forum. Finally, we have photographers here today. The photographs that are taken today could be used for Women's Health Victoria promotions or publications, so if you have any issues with that, please let them know. Thank you. Okay, it's now my great privilege to introduce the Honourable Minister for Health, Jenny Mikakos. Minister Mikakos has been a Labor Party member of the Victorian Party since 1999. First as member for Jayaka Province and more recently as the member for the Northern Metropolitan Region. Jenny grew up in Northcote, in her electorate, in a migrant working class family. She holds a Bachelor of Law and a Bachelor of Arts from the University of Melbourne, and prior to coming to Parliament she practiced as a lawyer. As Minister for Health, Jenny is committed to delivering world-class health services by investing in and reforming our healthcare system to ensure that every Victorian can access the very best care, regardless of their background, location or stage in life. And I asked her what she might be doing this weekend, and she said she'd be watching Eurovision.
Thanks, Beth. I have been up since 5 a.m. watching Heidi go through to the finals of Eurovision on Sunday morning. So hopefully my speech will make sense to you, but I will be having lots of caffeine today. Can I formally begin by acknowledging the traditional owners on whose land we are meeting. I pay my respect to the people of the Kulin Nations and to their elders both past and present, and acknowledge any elders who may be with us here today. Can I very much thank Beth for her very warm welcome, and someone who I've known and respected for a very, very long time in her work advocating for women. Can I also acknowledge Christine Fitzherbert, the Chair of Women's Health Victoria, and other board members, to Diane Hill, the Acting CEO of Women's Health Victoria, to Sonia Ilievska, Co-Chair, Women with Disabilities Victoria, to Claire Vasenga, the CEO of Family Planning Victoria, to Jamal Hakim, Acting CEO of Marie Stopes Australia. Can I also acknowledge Gina Rushton, your keynote speaker from Buzzfeed, and apologise in advance, Gina, that I will need to leave here to formally welcome all the mums and bubs moving into the Joan Kerner Hospital this morning, and which is going to be a very, very special occasion, but I apologise for that I will be missing your keynote address. Look, for me it's a really special occasion to be here this morning and have my first opportunity as the new Health Minister to come and address this really important forum. And I just particularly want to take this opportunity to wish you a happy birthday for the really important milestone of 25 years. That's 25 years of advocacy for women's rights, for women's reproductive rights. So congratulations, because I know that this is a room full of activists, and it actually has been this room full of women, largely women, who have been working together with allies in the broader community to advance women's rights. So thank you to all of you for those 25 years, and thank you to Women's Health Victoria for everything that you have done for Victorian women for 25 years. We know that women's health... Yeah, give yourselves a round of applause. Women's health and women's rights, we know, have always been connected. They've always been connected because up until the last few generations, we know that women did not have sovereignty over their own bodies. A woman was considered to be a chattel. She was the fairer or weaker sex. It meant that her body belonged to her family, to her husband, to her doctor, just about anyone but herself. In Victoria, a lot has changed. We had women achieve the right to vote in 1904, have the right to stand for Parliament in 1922, equal pay, at least in principle, since 1975. Then we had the decriminalisation of abortion back in 2008, and I was very proud to be a member of the Parliament at that time and support that really important reform and advocate within the then Brumby government for that reform. In 2015, we had the legislation passed for safe access zones so that women could access this important health procedure without harassment. And I'm proud to support that reform, and proud indeed to represent the then Health Minister in shepherding that important reform through our upper house. But despite these many wins, despite these many gains, these victories are yet to be seen as sacrosanct, and the connection between women's health and women's rights still exists. It exists, in my view, because every generation of women still has to fight to win or retain sovereignty over their own bodies and their own destinies. I see gender equality as still a work in progress in our state and in our nation, and it's an issue that's very much at the forefront of the Andrews Labor government's agenda. We know that all Victorians benefit from gender equality, yet gender inequalities still persist in almost every aspect of a woman's life, from childhood through to adolescence to when a woman enters the workforce, being a member of a family and starting a family, and in retirement. There are still so many areas where we need to do more. This is why we've established the Safe and Strong, Victoria's first gender equality strategy, and Safe and Strong identifies a range of priority settings which must be engaged to achieve gender equality in Victoria. Health, safety and well-being are all crucial elements of Safe and Strong, because we know that gender is one of the most powerful determinants of health, and all Victorians are affected by gendered health inequalities. Now, I've seen some of these public struggles for equality up close. I mentioned before that I was in the Parliament for the Victorian abortion law reform legislation, and I'm proud to have witnessed firsthand the many good women, including the Deputy Chair of Women's Health Victoria County Board, play an important role in that fight to decriminalise this women's health issue. And like you, I celebrated last month when the High Court declared that women did have the right to access private reproductive health care without being publicly harassed, and this has been an important step forward, very important step forward for women's rights here in Victoria, and also across the country as well, because of course it's got national implications. But I've also watched, and I do take a keen interest in watching what is happening overseas. I watched in the US, individual states are rolling back the gains of Roe versus Wade. Recently we saw a Republican from Florida describe pregnant women as host bodies whilst discussing setting limits on abortions. And that's a really disturbing way to dehumanise women. Just last week, Georgia became the fourth US state to ban abortion from 6 weeks onwards, making reproductive rights practically inaccessible. So what does this have to do with Victoria? In a word, it has everything to do with Victoria, because we know that women's sexual and reproductive health is a local and it's a global struggle. Make no mistake, those who oppose women's reproductive rights closely follow overseas tactics and trends. And in fact, I've been in the Parliament long enough to know that they talk about how they go to the US and they meet with people who have like-minded views in the United States in particular to talk about tactics and strategies. So we know that they are inspired by these global anti-abortion gains in places like Georgia. I've seen just recently, in the last 2 years, we had a bill, infant viability bill, introduced by an independent member in the upper house. And whilst that bill was voted down, it's important to note that we need to always be ready to defend this health issue as a woman's right. And I know that everyone in this room is at the front line of the local effort for women's sexual and reproductive health. It's the gains that you have all made, often one-on-one, one woman at a time, supporting women in their time of need, that I want to acknowledge and thank you for. You are the ones working to help women take control of their sexual and reproductive health, to break the cycle of violence against women, to fight for gender equality. Every girl, every woman that you help, every wrong that you right, every taboo that you break makes a huge difference. And I'm here to tell you that you are not alone, that I will work with you, our government will work with you, because we backed you when we legislated for safe access zones outside our reproductive clinics, and we backed you when we developed Victoria's first ever women's sexual and reproductive health plan. This $6.6 million plan sought to establish and to expand services to improve access to information and invest in training. We backed you when we funded the 1800 My Options phone line, which I'm really pleased to tell you has now received more than 5,000 calls during its first year of operation. Because what we heard in the last few years as we looked at women's access to reproductive services and information is the disparity that we've got across our state. And I acknowledge that we still need to do more in terms of access to services, particularly in regional Victoria. And we need to make sure that women of all backgrounds, all cultural backgrounds, all economic circumstances have access to the information that they need and the services that they need. Now, I do think that Victoria is one of the best places to live on earth. I'm very proud to be a Victorian, and I'm sure that you would be as well. I don't think that it's, we want to see us ever take a backward step down this path of progress that we have seen. But I guess the point that I want to make is that these rights are not set in stone. They have been hard fought for by all the women in this room here today. But there are those who want to seek to remove those rights, and that this is why we need to be continuously vigilant. We are focused, of course, on working together with all of you to promote the benefits of gender equality for all. And I mentioned before the first ever Women's Sexual and Reproductive Health Plan, and I want to acknowledge the important work that Jill Hennessy did do, Women's Health Victoria and others in advocating for this really important plan. It's been a really important piece of work since March 2017. As the new Minister for Health, I'm very determined to continue that important work, because I acknowledge the importance, the primacy of women's health and women's reproductive rights in our health system, in our healthcare, making sure that women and girls can get the access to the health services that they need, the information that they need when they need them, and to make sure that they are available close to home. As was already been mentioned, as part of this plan, we opened 6 hubs for women's sexual and reproductive health hubs, and I'm really pleased to announce to you this morning that we will have 2 more hubs open in July. These hubs will be located in Gippsland Lakes Community Health and Each Community Health, based in Ringwood. And welcome. Welcome and congratulations. These hubs will reduce the barriers and service gaps that affect women's access to reproductive and sexual health services, and I really, my ambition as Minister is to do more and make sure we can keep going in this effort. These hubs will provide information to women on sexual and reproductive health, including contraceptive choices, clinical services on long-acting reversible contraception, medication, termination of pregnancy, referral pathways for surgical termination of pregnancy, and much, much more. So women's reproductive and sexual health issues are really very much at the forefront of what we are doing in healthcare. we did recognise the need to improve access to these services, and we think that providing these hubs, it's a really important step forward in providing that access. I also want to acknowledge that it's also about breaking down barriers that women face when accessing affordable contraception and other services to control and manage fertility. And in addition to the hubs, we've also released for pharmacists comprehensive resources on women's reproductive and sexual health. And just last night I was meeting with the Pharmacy Guild and talking about what more they can do as primary care providers in this space, and I'm looking forward to working with whoever wins on Saturday to make sure we can continue to provide greater access and affordability of choices for women in our state but across the nation as well. And I probably will be doing a little bit more than watching Eurovision, but I'm very much looking forward to the opportunities, of course, that the Saturday presents. I did mention before that I'm off shortly to the Joan Kerner Women's and Children's at Sunshine Hospital, which is officially opening its doors today. But I wanted to also mention that this new hospital, named after someone who has been a mentor and amazing woman for so many women in this room, an inspiration to all of us. This important hospital will also boost sexual and reproductive health services in our northwest, and we know that some of our western suburbs of Melbourne have had particular issues around lack of access to these types of services. So these are significant gains, but we also face significant challenges. And I just want to mention in concluding that we are seeing rising rates of chlamydia, syphilis and gonorrhoea. And some of these are also becoming resistant to antibiotics, which present further challenges. So we know that condom use is decreasing and that a small proportion of women only are using long-acting reversible contraception. So there is certainly more that we need to be doing in terms of our sexual and health reproductive services for women. And this says to me that we need to keep working to make sure that our services are as accessible as they possibly can be, and the information that we're giving is as understandable as it possibly can be, and that every woman, no matter her background, no matter where she lives, should be able to access support and services that are safe and private, and that we need to keep working so hard to break down these barriers of gender inequality. So thank you very much for having me here today. I really feel that I am standing on the shoulders of giants, of amazing women who have come before me as Health Minister, as Joan Kerner and others. The women in this room, 25 years of advocacy from Women's Health Victoria, advocating on behalf of women. I'm very much looking forward to working with all of you over the next 4 years as your Victorian Health Minister. And thank you again for giving me the opportunity to say some words today. I wish you all the very best for today's forum, but also the upcoming ones as well. And I'm very much looking forward to working with you. Thank you so much.
I think that was very inspirational. The Minister mentioned many inspirational people, but I think she's an inspiration to us as well. So thank you. It is wonderful to hear about the additional funding for 2 more hubs in Victoria. We're very pleased about that. And thank you too for the fabulous support of 1800 My Options. We're very proud to run the service. And as the Minister quoted to you the numbers, it's quite phenomenal, the response that we have had and the needs. It's good to know that in some small way we're providing service to meet the needs of women in Victoria. The Minister also took us through a history of women's rights and the situation of women in relation to their sexual and reproductive health. And I think it's wise for us to remember that we've come a long way in a short period of time, and we must be vigilant. So it's also very pleasing to hear that the Minister, that you are committed to the strategy going forward, and we look forward to working with you on the next iteration of the strategy over coming months. So will you please join me in thanking the Minister for the fabulous presentation.
Sorry, thank you, Kristen. Thank you.
I'll hand over to Beth.
Thank you, Christine. It's my pleasure now to introduce Gina Rushton from Buzzfeed. She's a journalist, a reporter at the Buzzfeed News, previously a journalist at The Australian. She's published in the Saturday paper, Meanjin and The Lifted Brow. Access and equity in relation to sexual and reproductive health has been a long-standing focus of Gina's journalistic work, including having written over 150 articles in recent years on topics including abortion, LARC or long-acting reversible contraception, and reproductive coercion. As such, Gina has played a prominent role in bringing these issues to the fore at the national level. Please make her feel welcome.
Oh, thank you. Great. So I'd too like to acknowledge the traditional owners of the land on which we're meeting today, the people of the Kulin Nations, and pay my respects to elders both past and present, and of course to say that sovereignty was never ceded and that this always was and always will be Aboriginal land. I'm a writer, not a speaker, so if I stumble, please find it very endearing. My PowerPoint is so bad, but it's just supposed to be a visual aid, so let's just let it be that. A woman in Adelaide who waited days in hospital to terminate a wanted but unviable pregnancy. A woman in Albury who cancelled her surgical abortion because she couldn't enter the clinic as her relative was protesting outside. A woman in Hobart who paid more than $4,000 to fly interstate for an abortion and was then fired over her online reproductive rights activism. A woman in Narrabri who was turned away from 3 hospitals closest to her and drove overnight to Newcastle for a D&C after a failed medical abortion. A woman in Sydney who was told if she kept her pregnancy, she would get help with her visa. A politician in Canberra who had to terminate a pregnancy at 21 weeks for a fetal anomaly and cried in Parliament as she called out her colleagues for labelling her a murderer. A woman in Brisbane who was harassed outside a clinic as she tried to reach the door to terminate a pregnancy, which was the result of a rape. These are the women whose stories I tell. So 3 years ago, I started writing about reproductive rights and healthcare. So it started with a pretty cursory story about women who were being turned away from hospitals in Queensland. They were seeking terminations. But it was the beginning of what would have become kind of a full-time beat within my work as a gender reporter, and something that we quickly decided we were going to devote time and resources to. Iris Murdoch says that paying attention is a moral act, and I think in 2016 Australia wasn't paying enough attention at all to the thousands of women who were trying to make autonomous decisions about their own bodies and decisions for their families. So at that time the procedure was still in criminal legislation in the Northern Territory and in Queensland. Tasmania still had a dedicated surgical abortion provider open and running. The Tabit Foundation had recently started up doing postal abortions. There were no safe access zones in New South Wales, and South Australia was still seen as the golden utopia of abortion access, closely followed by Victoria. So a lot has changed in that time. And since that first story, I've actually published more than 200 articles, mostly features about abortion and contraception. So we began to map this issue from every angle, but our priority was to accurately detail the lived experiences of women facing barriers in accessing these services and the concerns of frontline service providers, which had largely gone undocumented in mainstream media. At best, stories about abortion were random and paternalistic, and at worst, they were sensationalist, misinformed, rife with myths and moralising, and often illustrated by this one stock image of a heavily pregnant woman kind of standing in the shadows. And some of it was ignorance and a lack of, access to data or information, and some of it was pretty deliberate from columnists who didn't disclose their extracurricular activities as Right to Life ambassadors. So my focus was Queensland because of the 2 pushes, the second obviously successful, to decriminalise abortion. So this meant that my features kind of intersected pretty neatly with state politics. providing a little more context and truth about these women's lives and as their right to healthcare was debated by politicians and lobbyists. My first few trips to the Sunshine State really opened my eyes to what women were dealing with and who had a stake in preventing both decriminalisation and increased access to abortion. So I spent the day at a crisis pregnancy centre. It looked like any other cafe with this kind of like Tiffany blue decor and freshly baked cakes, like really quite good cakes. But most cafes, of course, don't have an ultrasound machine out the back to show women what they'd be terminating. So this particular centre, which was co-run by Queensland's kind of staunchest anti-abortion MP at the time, his wife ran it, they offered women congratulations packs when they came in, whether the pregnancy was wanted or not, with kind of baby clothes and that kind of thing. So I would later write up about a similar setup in Albury, in which a cafe was raising $30,000 for an ultrasound machine for the Women's Life Centre owned by a Catholic parish to scan women with unintended pregnancies. I also spent the day at Brisbane's All Options counselling service, which you probably know as Children by Choice. And in the few hours I was there, a younger Indigenous mother called up about an unintended pregnancy to a violent partner. She'd just passed the cut-off to take IU486, so the counsellors sat in what they call at Children by Choice the money chair, where they all workshop how to raise financial assistance for clients who can't afford a termination. In the same couple of hours, a really distressed woman called up. She'd had an IUD inserted after like a clear pregnancy test, but she was pregnant. And the clinic was refusing to remove the IUD because they were scared she'd miscarry and they felt like they were in a legal grey area, which they were. So Children by Choice booked her into a private provider, who agreed to a discounted rate, and the woman who was on welfare began a payment plan, $15 a week to pay back the surgical abortion. Just a side note on this, I'd like to say that decriminalisation has magically solved the state's access issues in Queensland, but as you all kind of know, decriminalisation doesn't equal access, and the law is just a start when you're kind of tackling this inequity. And a few months ago I saw Children by Choice actually posted a Facebook status raising money for a woman in a violent situation who just didn't have the funds for an abortion in her area. So these financial disparities became a theme in our coverage as we pulled together price lists and dug into why IU486 was still costing hundreds of dollars in some places when it was on the PDS for $38.80. Nurses, GPs, counsellors and surgeons have all provided expert opinions. I went to Townsville and I interviewed the only doctor then performing surgical abortions in the 2,000 kilometres north of Rockhampton. A fifth of her patients had travelled more than 8 hours to get there. And she was kind of a small, no one in the town knew what her job was. She didn't feel comfortable talking to anyone about it. So for the most part, women have emphasised the compassionate clinical care they've received from doctors and nurses during what can be a complicated time. But in some cases, healthcare professionals have acted as a further barrier to access. One woman told me that her GP refused her a medical abortion because she was meant to be a mother. Another said that abortion wasn't possible because it was a crime. Another told her that abortion wasn't allowed after 9 weeks. The criminality of the procedure was a pretty opaque issue for our readers, so to offer some historical context, I interviewed a number of people who were around during Brisbane's abortion clinic raids in 1985, including surgeon Dr. David Gondeman, who was arrested, charged and put on trial for performing illegal abortions. As we expanded our coverage, much of my job became fact-checking and myth-busting. So one really great thing about having this massive global readership at Buzzfeed is you get a lot of what I like to call correspondence. This correspondence has a particular flavour when you write about women, and that flavour intensifies when you write about women terminating a pregnancy. I love correspondence. It tells me exactly where we need expert opinions. So it makes some people uncomfortable when I cite anti-abortion politicians and lobbyists, but that's exactly how I've addressed some of the biggest myths about this issue, because they're saying exactly what people in my inbox are. So we'll always cover it. We'll cover Fraser Anning moving a motion to make counselling mandatory before a termination. And then we'll map why the motion is redundant, as all Australians accessing abortion service in the public or private system are obviously offered counselling. We might quote Corey Bernardi when he talks about a baby being ripped from the womb at 36 weeks by a hypothetical doctor under instruction from a flippant mother who's just realised 252 days into her pregnancy that she does not want a baby. Or we'll quote Senator Barry O'Sullivan when he says decriminalising abortion will result in late-term partial birth abortion, and then we'll quote a lawyer explaining gestational limits, and then we'll quote a late-term abortion provider explaining what kind of situations they're in, and then we'll speak to a woman who's actually terminated a pregnancy at 24 weeks, explaining the financial and emotional cost of making that decision, and the ethics board approval it took to terminate her pregnancy, which was never viable. We might quote an anti-choice lobbyist telling a parliamentary committee that abortion causes breast cancer, and then we'll link out to research which debunks this, and note that this purported link has been widely and repeatedly rejected. When politicians emphatically say that there are no access issues, we quote them and then we speak to the women about the hoops they jump through for their abortions. When people hold up signs at rallies which say decriminalisation will allow for abortions for social reasons, we talk to women who have terminated their pregnancies because of substance abuse, financial hardship and mental illness. I fact-checked a lot of flyers, so many flyers. I can't express how many flyers I fact-check every week. Also, one of the things that I never reported on, because it was one of those things that was so... My editor said, oh, you should fact-check that, and I didn't even know where to start. In the parliamentary community, these lobbyists testified that abortion causes both promiscuity and frigidity. I don't know, presumably at the same time. And my editor said, that's amazing, you should fact check it. And I was like, I truly do not know where to go for an expert on this. Like an expert on sluttiness or being approved. I don't even know where to go. So when we broke the story about White Ribbon withdrawing its statement for reproductive rights, I didn't think there would be mainstream backlash in the way that there was. It really showed me that the conversation was changing when it came to abortion and, what we expect of bodies like that. The conversation's also changed in terms of what politicians are willing to say on the record. In 2016, even most Labor politicians in Queensland wouldn't chat to me on the record before there was concrete legislation. And it was actually pretty impossible to get federal politicians to talk about this unless they were really pro-choice or really anti-abortion, like Barry O'Sullivan, who once casually told me that there were many in his party who would like to, quote, lock up pregnant women up, bind their arms so they couldn't have an abortion. Very normal thing to say. Oh yeah, so that's when I didn't include this in the talk, but George Christensen wouldn't talk to me, so I faxed him, sent him a handwritten letter, texted him, tried to Skype, I just did this thing where we went, anyway, where I just tried to talk to him in every possible communication method. When we broke the story about the main surgical abortion provider in Tasmania shutting up shop, the Federal Health Minister was drawn into this conversation, as was the then Prime Minister. Greg Hunt said services had been restored, and they obviously hadn't. And then we did a story with a woman who had spent more than $4,000 travelling to Melbourne for a termination. We told her story then under a pseudonym, but obviously she's Angela Williamson, who was later fired from Cricket Australia for tweeting about abortion access. Labor's recent promise to ensure public provision of abortion, up the number of IE486 prescribers, create a national hotline and improve like access has forced federal politicians to talk about the issue, although the Prime Minister has refused to, as he says the issue doesn't unite Australians. He said that while standing on Christmas Island to talk about offshore detention. But I think I probably overestimated just how big of an impact Labor's promise would have when I noticed the fine print in the government's recently released women's health policy, where there was $4 million allocated for family planning organisations. and I thought, oh, like, wow, like maybe it's going to Family Planning New South Wales and Family Planning Victoria. Like I sort of thought they'd finally kind of waded into this. And then I pressed the Health Minister's office for more, and a quarter of it was for Billings Life, which is fine. Usually used to more to conceive, but that's all right. Politicians have brought a lot of misinformation into this debate, but because abortion's so common, they've actually ended up kind of humanising it, because a lot of them have had experiences with abortions. In New South Wales Safe Access Zones debate, the Deputy Premier talked for the first time about his wife's termination. In Queensland's decriminalisation debate, Labor MP Kim Richards said her mum had recently, just in the context of the debate, told her about her own backyard abortion, after which she said she was lucky to have escaped with her life. The other thing that has, of course, really changed in the past couple of years is the conversation about long-acting reversible contraception. I got my first Marina, or as my male editor calls it, the fishing lure thing, when I was 20, and no one my age knew what it was, and if they did, they just knew all the horror stories. And I was really sick of answering questions about it, and I said to my editor, I want to do like a step-by-step, like I'm going to get a new one, how about I just step-by-step explain what happens, they take it out, they put it in, like I'll interview my gyno, and then I can just send it to all my friends when they ask me about it. And I can't overstate how hungry our readers were for information about this. So this story, within a week, more than 1 million people had read it, which is like, I can't even think of a story anywhere in Australia that, like, yeah, the metrics on it were just like, oh my God, I guess people don't know about this. So one of the stories I did recently was about these Facebook groups I was monitoring, in which thousands of Australian women talk to each other about IUD side effects, from nausea to depression to infertility to psoriasis to cavities. People are attributing almost anything to their IUD. They're also encouraging each other to remove their own IUDs or get their husbands to do so. So I decided to do this big fact check with experts about what could reasonably or statistically be linked to their IUDs and what was maybe improbable. And also obviously to explain why you shouldn't remove your IUD at home. So this is a bit of a tangent, but the day after I published that, I woke up in excruciating pain, and I was at my boyfriend's house, and I wasn't really. We'd gone out for Thai the night before, and I thought, oh, I'm not really at the stage of my relationship where I wanted to discuss the potential repercussions of this spicy Thai meal. So I just took myself to the bathroom, and I was like, pain's getting worse. Okay, it's really worse. Ended up on the bathroom floor, and my boyfriend's like, I think we should call an ambulance. And I said, I don't want to waste resources. Don't call an ambulance. Like, I'll just get in the cab, and I could not get off the floor. Anyway, ended up in the back of an ambulance. On so much morphine. So I just want to express I had a lot of morphine. But I was lying there and I was thinking, oh my God, my IUD's perforated and I just published this article. Like, I was lying there, this poor paramedic, and I was going, how many IUD perforations do you see per year? My understanding is that there should be external bleeding. I don't even have spotting. And she was kind of like, okay. And my boyfriend was sitting behind me in the ambulance, and I'm looking back up at him, and I'm going, I'm just another woman who's discounted women's pain. I've done this huge fact check with all these, providers that have said that, like, perforations never happen and that it's a really safe contraceptive option, and now I'm in the back of the ambulance, and I just sort of discounted what they were going through, like I'm worse than a transvaginal mesh surgeon. And I'm like, lying with my poor boyfriend, and my boyfriend's going, she's not unhinged, she just cares about women's health. I get into the hospital, and I'm just completely paranoid by this point that it's like my IUD is perforated. And they get me in for an ultrasound. They're doing this internal ultrasound. I'm in so much pain, and they're going like, oh, like there's that's the ultrasound. They're going like there's this internal bleeding. And I'm like, where's the IUD? Show me it on the screen. Anyway, the surgeon comes in. She goes, okay, well, you're bleeding out of your uterus into your pelvic cavity, and we think that you have an ovary torsion and your it sounds so dramatic. She said, we think your ovary's dying, that it's like cut off nutrients, and like worst case scenario, we're going to have to go in and we're going to have to cut out one of your ovaries, and it has massive, fertility like ramifications. And I said, oh thank God. I said, oh my God, thank God, it's not the IUD. And she's like, okay, we're right. They got me into this emergency laparoscopy. And I came out, and the surgeon came out, and he said, well, the good news is like the ovary's still there, you had a birth cyst and blah, blah, blah. But the bad news is that you have endometriosis. And I said, oh, like, okay, is there anything I need to do about it? And he said, well, we normally just suggest that you get an IUD. And I was like, so really? The best case scenario, I was already doing it. Anyway, that's still on morphine. So that is, of course, the happiest endometriosis diagnosis you will ever hear. I appreciate that that's extremely uncommon. But it does kind of speak to something that I think, just as an observer, obviously not as a clinician, what I think is quickly becoming one of the biggest issues in women's health, and that is trust. So I read through every submission in the Senate inquiry into transvaginal mesh implants and interviewed some of the members of the class action about their experiences of being ignored by their doctors, and many of them had lived through more than 3 decades of debilitating pain, fractured careers, lost time with their children, the death of their sex lives, and sometimes the end of their marriages. And the Senate inquiry heard time and time again about how these women were made to feel ignored and told kind of that they were made to feel hysterical, told to just have anal sex or to retire any desire for sexual function or pleasure. So one of my favourite writers, Leslie Jamieson, wrote about a 2001 study called The Girl Who Cried Pain, which tries to make sense of the fact that men are more likely to be given medication when they report pain to their doctors, and women are more likely to be given sedatives. The report finds that despite evidence that women are biologically actually more sensitive to pain, their pain reports taken less seriously. So meaning more specifically that they're more likely to have their pain discounted as emotional or psychogenic and therefore not real. And I mention this because I completely understand why women don't trust their doctors when they've had their pain ignored and they're made to feel like they don't know their own bodies. But on the other end of the spectrum, I've really seen how this mistrust of the medical profession can leave people really vulnerable to misinformation, like with those Facebook groups. So I've written a lot about, I won't go into that, but I've written a lot about reproductive coercion, and I think I don't see that being really effectively tackled if women don't trust their doctors, obviously. I just want to finish by talking about the way in which move that off the screen. I just want to finish by talking the way in which women's health is discarded as a genuine political issue. And I guess the only way I can really speak to this without offering my opinion, because I'm a reporter, I'm not a columnist, is to talk about how I'm treated as someone who writes about this stuff. So a friend of mine recently assumed that I'd had an abortion, and statistically I could have, of course. And she said, I just assumed you'd had one because you write about it so much. And I was so offended, and not because I think having an abortion is something to be ashamed of, but because female journalists are always seen as activists with this kind of personal and emotional attachment to what they're writing about. And it's just an assumption, this assumption that I'd had an abortion and that it motivated my journalism is not something that we would ever apply to men in the media. We don't assume court reporters have been victims of crime. We don't assume press gallery journalists were formerly political staffers. And if we did, what would we think of their reporting? You know, surely the implication there is that it's coloured by personal experience or corrupted by bias, really. Good journalism isn't activism. I've never written an opinion column. I've never stated my personal opinion on reproductive rights. I was once encouraged by an older male journalist to carve out a new, more serious or political round for myself because I'm at risk of being lumped in with women's websites. This was a couple of days after we'd published an exclusive detailing court documents which showed that lawyers for the Department of Home Affairs argued that a pregnant refugee on Nauru with extreme genital mutilation couldn't, who wanted an abortion, couldn't come to, didn't need to be brought to Australia for the procedure. The lawyers said that because the woman's vagina had been unstitched, she should instead have the operation in Taiwan without specialist care or with the aid of an interpreter. And I just, obviously that's an extreme example, but what could be more serious than inequities in our healthcare system which punish the most vulnerable women, and what could be more political than the fact that there are people in Parliament who want to kind of facilitate that, or decrease access. So as I said earlier, paying attention is a moral act, and you've all been saints today. Thank you for your time, and please come and chat to me if you have any ideas for stories. I'd really love to hear from you.
Thank you so very much, Gina. You said that you're a journalist, not a speaker, but I think that you established today that you are definitely both. So thank you. Another round of applause. And I'd just like to remind people that next month is the 50th anniversary of the Menhinnitt ruling, in which the Supreme Court considered what a lawful abortion might look like. It's been decriminalised now, but that was a case that served Victoria really well, and indeed other places, for a long time. So we must celebrate our anniversaries, though Judge Menhinnitt was really looking at the rights of doctors rather than the rights of women. I'd now like to introduce Carolyn Mogharbel, who's the team leader at 1800 My Options, Victoria's phone line for information and services relating to contraception, pregnancy, options and sexual health, run by Women's Health Victoria. I'm going to cut this short a little bit because we're a bit over time. With a background in sexual and reproductive health service delivery and health promotion, Carolyn has extensive experience working with marginalised and underserviced groups around the issues of health service access and equity. Welcome.
Thank you, Beth, and thank you, everyone. I would also like to acknowledge the traditional custodians of the land on which we're meeting today, the people of the Kulin Nation, and pay my respects to elders past, present and future. Thank you. I'd also like to say how humbled and delighted I am to be in a room full of such amazing people, to be on a panel with Gina, to have the Minister speak. It's a really exciting event to see so many champions here today who are dedicated and willing to talk about women's sexual and reproductive health. It's so exciting to bring this out of the shadows. So 1800 My Options, I know that a lot of you are really familiar with our service, but I'm here to talk about it a little bit today and talk about some of the things that have happened in the last year since we launched. We're a phone line. We're open 10 to 4, Monday to Friday, closed on public holidays. We do need a break. We have a website as well. We're a women-centred, confidential, non-judgmental, free and pro-choice phone line. I'm sure that you all know how rare that is. We're also non-clinical, and I think one of the really unique and special things about our service is that we are completely non-preferential. Being women-centred means that we talk to the women that we're speaking to and we hear what they need, and we find the service that will meet their needs in a non-preferential and unbiased and non-judgmental way. When we started 1800 My Options, we launched on the 19th of March 2018, and we had this map that we were using to refer women to sexual and reproductive health services across Victoria. The map had around about 25 or 30 dots on it, and around about 50% of those dots were not visible to the general public. This is our geomapping, and so this is what you're seeing now is our current map that's visible to the general public. Due to the work that we've been doing with the sector and the amazing champions of the sector, many of whom are in this room, we've now got almost 300 trusted sexual and reproductive health providers that we can refer women to. We know that these providers will support women with their choices, will meet their needs, and are going to be pro-choice and non-judgmental. I think one of the amazing innovations of 1800 My Options is the fact that we started with 25 or 30 providers on a map, and now we've got all of these champions for sexual and reproductive health spread across Victoria. I know, having worked in sexual and reproductive health for a little while, how difficult it was to find someone who you could talk to and find someone who you could refer people to. I've worked with young women, young people in protective care, I've worked with sex workers, I've worked with people who inject drugs. And to find somebody that you can actually link someone safely to and be confident that this person will meet somebody's needs, that somebody isn't going to have to travel for 4 hours necessarily, to find a sexual and reproductive health service is absolutely revolutionary. We've had over 5,000 calls in just over a year. So that's 5,000 women that we've spoken to, we've listened to, and we've connected them with sexual and reproductive health services that actually met their needs. We've got almost 300 trusted providers on our database, which is exciting. Of those 5,000 callers, over 95% of them are looking for abortion services. You can do the maths on that, but that's incredibly significant that this number of women weren't able to just go to their GP and have a chat about it, weren't able to just find a local service. The need for someone that you can actually talk to safely about your abortion needs is just huge. Around about 88% of our callers are from metro Melbourne areas and 12% from rural areas. This is a little bit of the data from our first year of service. So I think it's really relevant to point out that the data that we have on the callers who are seeking abortion services largely is really reflective of the data that we see across Australia around who is looking for an abortion. So most of our callers are aged between 18 and 35. There's a very few who are under 18 and a larger number are 36 and above. I think this is a really important thing to be bringing out and talking about a lot. There's a stereotype that women who seek abortion are young teenagers, that they're silly and all sorts of things, but a lot of the women that we speak to are mothers and women who have finished their family or don't want to have a family or whatever it is. These are women who are making active and educated choices. It's also important to say that most of our callers are under 9 weeks gestation. Women are aware of what their bodies are doing and aware of what's going on with their lives and know and seek help to get their abortion services early. I think that's a really important thing to acknowledge. Most of our callers come from Melbourne. We've got a massive chunk of callers coming from the northwest region of Melbourne. We've got lower numbers coming from Southern Metro and Eastern Metro, and then our callers from across rural Victoria are quite well distributed across the areas. So some of the things that we're seeing in our service coming up are similar to what Gina has discussed already. Access is one of the big things that we see, and one of the big barriers to women are the financial issues that really come up for someone who's seeking abortion or other sexual and reproductive health services. It's not that cheap to get an abortion or to get an IUD or to get an implant on, depending on where you live. There are a lot of bulk billing services across Victoria, but there are also a lot of areas that don't have that kind of access. And that's one of the really big issues that we see in our work is women needing to travel, women not being able to find a place close to them that they can actually access. Health literacy is another one. Gina's already talked a little bit about the myths around IUDs, and these are huge. There's also a lot of myths around abortion. Medical abortion is one of the ones that we talk about every day, and our amazing phone operators every day are addressing these myths and saying, no, it is not very likely that a medical abortion will fail. It is a very safe and very common procedure. I think it's important also to say that with that health literacy, that these myths are not just coming from the general community. It might be that I spoke to my cousin who had a negative experience, but it might be also that I spoke to health professionals that have their own biases or aren't up to date with the latest evidence. Stigma is huge, obviously. The lack of publicly funded services is particularly significant, and it's really exciting to hear the Minister talking about access over in the western suburbs. But there's also other parts of Melbourne and other parts of Victoria where access, particularly to surgical abortion options, are very, very limited. Conscientious objection, obviously. Also obstruction and the refusal of service is an ongoing issue in Victoria, despite the fact that we have legislation that should be preventing that. Last of all, I'm just going to talk briefly about how we're really unique, 1-800 My Options. Obviously, I'm a little bit biased, but I think that one of the fabulous things that we do is we work in partnership with the services that we have on our database. We have personal and ongoing relationships with a lot of the key services that we work with. We want to make sure that we are referring women appropriately, but also that these services are having their needs met as well by us. We engage with the wider health service system, and Georgina, who's going to be on our panel briefly, has been travelling all over Victoria, engaging with the wider health service system and really ensuring that mainstream health services treat women's sexual and reproductive health as a part of mainstream health and really bring it into what we provide as a general primary healthcare service. We do a lot of capacity building, and again, that's a partnership that we have with a lot of organisations. And I think that one of the really exciting things that I can say for 1-800 is that we are bringing together information and services that we can use in forums like this and that we can use with our partnerships in terms of advocacy and further policy development. If anyone wants to talk about 1-800 My Options, we're happy to do so, but I'm aware that we're running quite short on time, and so I might pass back to Beth. Thank you, everyone.
Thank you so much for a fabulous address on non-judgmental service for women. The non-judgmental part is so important. I remember once being asked by my doctor about my medical history, and I said I'd had 2 abortions. He said, 2 stops. I thought, that's kind of nice. Very sensible. Compared with a complaint that I had from a man who called me on behalf of his wife when I was Health Services Commissioner. She had a grown-up family, found herself very early in her pregnancy that she didn't want, went to the doctor who said to her, if you insist on pursuing this, I'm going to put you on the mental health database and then no one will touch you. Unfortunately, there are all too many of those stories. So thank you very much indeed. We're now going to have our fabulous Q&A. So would all the panellists come up to the stage if you're not already there? Millie, thank you. Have we got everyone? Gina, Millie, Carolyn, Georgina. Okay. The floor is open to all of you. So don't make us use Dorothy Dix's. There must be something that you want to ask.
Well, before anybody asks anything, I'm happy to talk about the strategy, if you like, and just thank you all for participating in you would have all met.
Come over here.
No, it's not.
You use that one.
Okay. Many of you would have met me while we were developing the strategy in 2016-17. It was a big effort, and I thank you all for contributing to it. You know that it was as a result of having the State Public Health and Wellbeing Plan, which identified sexual and reproductive health as one of the priorities. You are probably aware that currently the department is having consultations for the next lot of the Public Health and Wellbeing Plan, and I hope that all of you will be contributing to it. As the Minister said, the focus has been on establishing services or expanding existing services or establishing new services, and on health professional training. The government has also announced community hospitals that I trust that you're all following, and there is a list of community hospitals, and at the moment the consultations are happening about services that are going to be offered in community hospitals, so I would like to encourage you all to contribute to those consultations. Thank you.
Thank you. Anything further? Microphone awaits you. It's your big moment. I've never seen women so shy. Oh, thank you. One there and then one there.
My question is probably for Carolyn. I was wondering if the services you have listed on the map are able to provide 1-800 My Options with information about their disability access. So if you're referring to them, whether it's possible to say to the woman she's got a disability, what access they're able to provide. Yeah, absolutely.
Awesome question, and we didn't set this up, honestly, but we are currently working on our geomapping to ensure that we are showing what issues women might be reflecting to us that they want shown on the geomapping. So one of the things that we're going to be updating with the geomapping is showing whether the place has disability access. Each of the providers in our list on the geomapping has a notes section where we're going to ask them to describe the nature of the disability access if they've ticked that little box. Some other points in that are, with our geomapping, we're also going to add whether a service has bilingual health workers working there, whether a service is LGBTQI+ friendly, whether a service is an Aboriginal health service, and I think these are really important points that women want to see. Yeah, thank you.
Thank you. Thanks. Question here. And then over to you. Can you hear at the back? No.
Oh, sorry.
I think you've got to come right onto that mic.
Okay, excellent. Sorry. I'm a rural gynaecologist. My question is really quite simple, and it's probably for Millie, the Department of Health. Could it be as simple as a directive to both tertiary hospitals and regional hospitals that they need to be providing comprehensive women's health care, which is abortion services, which is contraception in all of its forms, and by directing health services and funding those services, that they then need to provide them and are held accountable for providing them, and those of us working within the system have a system to work within.
Is that a simple question?
Okay, the idea of the plan was actually to make sure that women can access services in primary care rather than needing to access tertiary services. Hence, the whole plan has been geared towards that. So it is not possible to meet the needs of women with 8 hubs. We all, I think, understand that. We do need GPs to be involved in primary care. Because I come from a prevention and population health branch, for me primary prevention is a key. So starting with long-acting reversal of contraception as the most effective and cost-effective option, going on to emergency contraception. If contraception fails, then medical termination. All of those can be actually accessed in the primary health sector. It's only the surgical termination of pregnancy where we need hospitals. So if I just go back to, there was a lot of talk about stigma and myths versus facts. So I would encourage you to go on the Better Health channel, which is the trusted, always the most trusted information, a source of information for all consumers, as we know from many surveys. We have updated information together with our partners on contraception and termination of pregnancy and sexually transmissible infections, endometriosis, polycystic ovary syndrome and menopause, which are all part of the Women's Sexual Reproductive Health Plan. And we also have fact sheets on myths and facts in that area. We have recently translated those documents into 15 languages for abortion, a few for contraception, but we have also provided links to external resources in community languages. So we do hope that by having you here working towards empowering women to demand that information from health professionals, telling them that they're wrong if they tell them, like Gina has told us, that luck is not for them, to challenge those professionals and make sure that they get the services that are essential services for women's health.
Thank you. I think that we should find out where the refusing hospitals are, and we should add up how much that would cost to provide those services and reduce their budgets accordingly. Over here.
Thank you. Caroline Mogharbel, midwife and from the Burnett Institute in Melbourne. Thank you to all the speakers. Gina, particularly wanted to thank you for your courage in standing up for these issues. This is really hard stuff, and we're really grateful that particularly a bright, young, fabulous woman is standing up for the issues that we've been fighting for many years. And on that, I just wanted to ask you if you could give us some advice in this world of Twitter spheres and online cyberbullying, which I'm sure as soon as you write the word abortion on a tweet, the skies light up. How have you managed that sort of personally and professionally to kind of keep doing what you do? Because that's, I think, a really important issue for many of us who are advocating in this space.
It's a really good question, and I wish I had a kind of helpful answer, because as I said, I do read a lot of the correspondence I get because I use it to do fact checks, and it is really upsetting. Like that like long blog post by Kathy Clubb was pretty upsetting, but I think the way to deal with it is one to talk to people about it. That sounds really pathetic, but when I get like a particularly unhinged email, and sometimes like, you know, I'll get sent pictures of fetuses or whatever, sometimes weirdly not, like just animal fetuses. Like there was one I got sent the other day that I was like, that thing is growing whiskers. I used to not tell my editor or tell Tony Mogharbel about it because I thought, I really want to write about this and they're going to think that it's too much. But to really quickly offload immediately, like I'll turn to my colleague and say, look at this unhinged thing that I just received. What a crazy world we live in. So that's one thing. The other thing is that, and I'm not like very tech savvy evidently, but that you're able to filter your emails with certain keywords, and so that's something that I've done as well. There are like definitely tools to do, and also Twitter has this quality control function, which you can use, and that's filtered out anything really bad. Like the other things are usually not too aggressive, but it's now filtered out things that are like particularly offensive. So that's a really good tool as well. But also, if you don't need to be on Twitter, I would not recommend it. Like I need it because I need to self-promote constantly to keep my job in the media. But if I didn't, I would never go on it and make my own account, or I would go on it kind of as an observer or something and not tweet my own stuff. So I would also say, if you don't need to be on Twitter, don't be on Twitter. It's a horrible place.
Thank you. I think this will have to be our last question, Louise.
Well, this is a question for Millie. And thank you to all of our speakers. But I just want to raise the flip side to unwanted pregnancies, which are wanted pregnancies, and there are issues of access to information, misconceptions about this area as well. And I wonder whether any consideration has been given in relation to the reproductive health hubs to broaden the remit to include some information about fertility issues too, because rural access is very difficult with this sort of information as well. People are going straight to IVF in case they don't need to. They may just need some advice about the fertile time of the month, for example. And so I'd be interested in whether there's any thinking around that as well.
Thanks, Louise. So as you know, fertility is one of the first priorities in the public health, in the women's sexual and reproductive health plan. And as you know, all of that is about healthy style and healthy living. Fortunately, in my branch, we do have precisely those areas of work. So tobacco control and healthy eating and physical activity. The department has been working with health services on ensuring that all health services have this information. We did some work with Quit Victoria, and Vic Victoria is including actually in their package about tobacco control issues about fertility. So it's actually much broader than getting that information just through the hubs. and it's certainly the information that we also have on the Better Health channel and are promoting through other means and ways.
Thank you.
And of course we have Arthur who is working on it.
Okay, thank you. Okay, thank you all very much indeed. It's time for morning tea, which is served on both sides of the room. If you could all be back here at 11:25, then we'll explain to you about how we're going to run the workshops and get all of those brilliant ideas out of you. Thank you.